don't palpate this way. Okay, so you want to like hold their, for example, if you want to palpate their arm, so you want to hold their wrist, this joint, and then place your hand on the shoulder. For example, if you want to palpate the lung 1, lung 2, so this is the clavicle, and then this is the lung 2, lung 1. Tender. Okay, lung is good. So this way. So when you push, you kind of push against towards your hands, not just this way. They will feel very uncomfortable if you just push them. Actually, you look at you push them. Yeah. So your other fingers
like
stop.
squeezing all.
Yes.
Okay.
What if their shoulder is really large?
Really, how large? How large? How large? Yeah, we do. Yeah, but. So you mean you cannot really place your hand? This is also good. So you can, for example, if it's really huge, we don't have huge shoulder. So for example, if it's really huge, you can still place your hand, finger here, and then palpate. And then along the, for example, if they have the carpal tunnel, so you can palpate from the shoulder. So for example, the liver, not the liver, L-line 15, L-line 15, and then the 三焦 14, 三焦 14, 肩鱼 肩髎, and then the L-line 14, 臂闹,
His butt sore.
and then L-line 11.
Always sore.
L-line 11. So once again, when you palpate, you want to penetrate your strength, not just rub on the skin. Okay, so penetrate. So you can also palpate, for example, if they have the tendon spasm of the tendon, or you can feel the tendon. There's a major tendon here. That's the L-line 10, tender, but not too bad.
Not too bad.
This is a normal. You should feel tenderness
The 11 was a little rough.
here.
Yeah, that's a little rough.
Do you have any elbow issue? Okay, and then again for the carpal tunnel, you want to check maybe the L-line 三焦 5, 三焦 5. Tennis elbow also maybe some acupoints on the small intestine meridian, heart meridian. So along the meridian, and then the L-line 4. Tender?
A little bit.
Yes. So when you palpate this is also good for before you do the acupuncture, you palpate and then you feel where the pain is, the trigger point. Some of the trigger point they're on the usher points on the meridian. So when you palpate the L-line 4, you want to palpate towards the center of the palm. So like this. Okay, and maybe for the lung, if they have the lung heat, you also want to check the lung 10. Okay, so that's on some palpation on the arm. So remember you use your whole hand. Thank you. And then we're going to palpate on the lower leg. So for the ST, this side, ST 36. So this is the kneecap. This is kneecap. This is the lateral eye of the knee, 3 tone down, and the 1 finger breadth lateral. Feel the tenderness? Not too much.
Not terrible.
A little bit. Okay. So so you can palpate along the stomach meridian. If they have the digestive issue on the right leg, it will be more sensitive along the stomach meridian. Yeah, because the stomach is associated with the right side. And then this is the head of the fibula here. And then anterior, inferior. So you can feel a tendon. This is on the gallbladder meridian. Gallbladder meridian, very sore. Okay. And the inside, if they have the knee issue, So there are 5 points. So basically, this one. one is better. 5 points. So the 鹤顶 SP10 articulation.
Yeah.
ST34 medial and lateral eye of the knee. 西眼. Okay, and again, later you will palpate on the gallbladder meridian. Gallbladder meridian is very obvious. And then for the medial side, so earlier we mentioned spleen 9. Spleen 9, tender.
A bit, yeah.
A bit, but she's very fit. She's very fit. No, there's basically no swelling.
6 is gonna suck.
And then here, tender.
Oh, yeah.
SP. This is SP6. SP6. And then between the medial ankle and the Achilles tendon. So here is the kidney 3. Oh, there's also a tendon. So we take off your future
Sorry,
shoes.
my foot is
It's
sweaty.
okay.
I apologize.
It's okay. So here is in between the first and the second toe. So spleen, liver. Yeah, like it. Liver 3.
So nice.
So nice. Liver.
Is that liver deficiency?
Liver. No, I think it's a liver Qi stagnation.
Oh, yeah.
Liver deficiency, normally there are only 2 syndrome, liver blood deficiency, liver yin deficiency. But liver blood deficiency, you also want to check the blood deficiency symptom, like pale everywhere.
I'm day 2 of my period today.
Oh, they, okay, be gentle.
That's why
Gentle.
that's sore, yeah?
Yes, that's
Yeah.
also, so if you feel more sore on the spleen 6
Oh, yeah.
and the liver 3, that's normal
Yeah.
for the period.
Yeah.
Okay, so I'm going to palpate the tummy area. So you can do the this palpation. So this is the liver. That's normal.
Oh, there's nothing in there.
She saw a good one.
Uh-oh, you're hungry. See, there's a gurgling sound already.
Damn hungry.
Okay, and actually, this is a more practical. So you can rub the tummy area like this. So here is the stomach area. Tenderness,
A little bit.
a little bit, and level with the tummy button. Yeah,
That's tender.
that's tender. How's your bowel movement? Is it regular?
Yes.
Yes.
Mid-period, it's always a bit
Oh.
wonky.
Oh, okay.
Everything is a bit wonky
Mhm.
mid-period.
So why you want to do that? Because by this palpation, so you can, in general, you can find out there's any lumpy nodule in the abdominal cavity, and then you can further do this one. But she's fine. There's nothing major. And then
You're just tapping your hand?
yes.
You listen to the sound.
Yeah, it's on the bones.
Okay.
Like
No
on the,
more sound like this.
the joint.
No what?
No more.
No more.
Normal.
Oh, normal. Yes.
Yeah, if there was like a major, like a cyst or a tumor or something in there, it would sound very different.
Yes. But that's why I said you want to palpate first to kind of find out the where it is. Okay, and then maybe on the rib cage, so you can also, this is for checking the liver. Not too bad. This is just a normal, And then this side. Yes, pretty good. And so for the appendix, there's a very special type of pain. It's called rebound pain. So you use your 3 fingers, those 3, and press deep, and then quickly remove your hands. So if they feel pain, so that means
That's
there is
pain.
inflammation on the very superficial, the abdominal wall. If otherwise, it could be just like the pain of the organ pretty deep. And the other possible is the about the rebound pain is the gallbladder issue. So again, you palpate gallbladder and you use your 3 fingers, press deep. No pain, obviously. No pain. Okay, and then please, do you mind we work on your back? Yes.
That's pretty deep.
Yes, it must be very deep. So let me finish all the okay. So for the back, the neck. So GB20. GB20.
That's sore. I have neck issues.
So once again, don't rub your patient. Don't torture your patient this way. So you use those fingers support, and then the thumb. You use your thumb, and then sink your qi down to 丹田. Okay, and then the qi is from your 命门, and then to your hip, shoulder, elbow, wrist, and the joint. Don't tense up like this. So after she relieved the pain, relieved, and then you will have the pain. Okay, so sink your shoulder hurt.
Oh yeah.
So you can feel there's lumps. There's some lump.
Yeah, I have neck issues.
A
Lots
lump.
of them.
Okay. And then, so this is a one line, starts from GB20, and then you can also do the Wangu. I think this is GB12, GB12, yeah, from the side. Okay, and this side. Very weird position. Which side is worse?
So my scalenes are worse on my right and my SCM is worse on my left.
Oh.
So GB12 will be worse on the left side.
Okay, and then the
GB20 will be worse on
shoulder.
the right.
Shoulder, this is the trapezius muscle. Right? This is the trapezius muscle. Trapezius muscle. So you can hold this muscle and then rub, and also feel the tightness. The tightness and the lift. Okay. So this is also some like a palpation on the acupoints. So for the GB21, tender. Okay. And then the SI11. Yeah. Most of people SI11 is very tender. And then you can check along her spine.
It's basically doing twin
No, so checking. Twin eyes it will be longer time and deeper. So check whether they have the scoliosis or any problem. Okay, so if the muscle is very tight, you can also use your elbow.
Yeah.
Felt the tenderness.
Yeah, it's awesome though. I got no complaints.
Okay. And here, but you have you see her back is not straight, flat. There is bulge here. So that is about your heart shoe, and this is spleen. So this area is very bulgy. It's pretty, not really very bulgy. It's a little bit.
bulgy also diagnosis.
So it's for some people it could be due to the compensate of the their movement. So for example, if they have the shoulder pain, so they may use other part of the body to compensate. So this area could be more, see, like for her, because she has a relatively pretty weaker shoulder. So
Okay, it's true.
tender. So
Yeah.
this whole area is very tight. So you can check along the gallbladder meridian, and then the bladder meridian, the two lines of the bladder meridian, and then the governor vessel, and then on this side. Also, so this is you can palpate, check, or you can use your elbow. Oh yeah, so tight, so tight. And on the lower back, if they have lower back pain, so we want to palpate which vertebrae, so level with the hip, the crest of the hip. So that's roughly the L4. 2, 3, 2. So this is the L2. That's the kidney points. That's the kidney point. So you can palpate those acupoints. Any tenderness?
Yes.
Okay, and so it really depends. Some people, their vertebrae issue may start from T12 all the way down. So you can check along from the T12, L1, L2, L3, L4, L5, and to the sacrum. Any tenderness here?
A bit.
A bit.
Not horrible.
And then this side.
Definitely worse on my right than my left.
Okay.
But I'm tighter on my
So
right
once
than my
again,
left.
when you check the back, you can check the spine, and then 夹脊, and then bladder meridian, the first line, second line of the bladder meridian. So you can use your finger, your thumb, or you use your hand, the palm. So tight. And then some acupoints. So for example, this is a GB30. Felt the tenderness.
Not terrible.
Okay.
That
Or
one
you use
is.
your elbow.
One
Huantiao, yes, Huantiao, GB30. And then the hip. So if they have the sciatica, so probably they also feel the pain on the side. So it's actually if you can palpate your bone on the hip, so that's beneath the bone. So there is a depression below the bone. And then the greater trochanter. Okay, and then the bladder, this is a bladder 36, I think bladder 36. Hurt?
Not too bad, no.
Not too bad. So for the sciatica, you check the sciatic nerve may travel this way and this way, the branches. So here, nothing.
Just regular muscle soreness, nothing.
Mm-hmm. Okay. And for the knee pain, you also may want to check the back, the Weizhong bladder 40. Any tenderness?
A bit. I have a knee injury that I'm
Oh.
still rehabbing.
Okay. So which side? Both sides? This
Was
right
my
side?
right side, I subluxed my
Oh.
patella.
Oh my goodness. Okay. All right. So that's about the examination, the palpation. You want to try? Do you want to try, or we change another
So what's the diagnosis?
diagnosis? Diagnosis. She has a lots of the stiffness of the muscle on her back. But we didn't check the pulse or the tongue, so we don't know the organ. But we can. we can palpate. For example, if you want to know the organs, so you can check. For example, this is a inferior angle of the scapula. That is level with T7, right? So 2 vertebrae up. So that's the T5. Hard point. Any tenderness? Yes.
Yeah.
Study too hard. Makes your heart. And so lung point. So if they have the asthma, so when you when you rub, so it may becomes red after you rub the skin. And then, so also from here, this T7, and then 2 vertebrae down, so this is a liver, T9, level with T9. Any tenderness?
Not bad.
Not too bad, but your muscle is very bulgy on this area.
Yeah,
Liver and the spleen,
I do,
spleen.
martial arts that's very upper body heavy.
Oh, okay.
And I train with people that are twice my size mostly.
Oh, wow.
So
Okay.
I compensate a lot because I'm not really strong enough.
No. Oh my God. Okay, so we regulate the T. Okay, next one.
I'll go.
So okay, so here's your T on this side. First of all, you look at her. This is the styloid process here. So for everyone, it's very obvious. Right? It's very obvious. That's the bone.
So that
This is
was
the bone.
middle finger.
Yes. So you place your middle finger here, and then you will naturally place the other two.
Uh-huh.
So you may not really feel the pulse, but you can rub your finger over this area, so to feel the. Otherwise, some students told me, I cannot feel the pulse, no pulse. But actually, so
You're
each
dead.
individual is different. So maybe
course.
some people, their pulse is more medial, and some is more lateral. And some people, they may have the pulse travels this way. So we call that 斜飞脉. So it's a flying away. But in general, so this is first, you find a 关, and then place your middle finger and then the other two. And rub it to feel the most strongest, the pulse beating. Wiry. Okay, it's a wiry. Heart pulse is it's weak. Okay.
Like,
Can I try?
Yes,
I'm
sure.
done. I'm
Sure.
done.
Yeah, so here is the styloid process. You place your middle finger. 弦脉.
咸
Very strong.
Strong, right? Wiry. 就是像
That's
琴弦一样.
so the middle one is wiry, this one is weak.
Yes. Okay.
So everything.
at the same time.
Yes. So there's some combination, but in this class we're going to study each of the poses one by one, and then in the clinical practice, very likely. So you are going to. But not
So
good.
in
not
here, the
good.
stomach one is the middle one, right?
Yes, the stomach one.
That
is the
was
middle
weak.
one. Or you want me to check to show you how to place the finger on your wrist. Okay, so 这个就是你
Yeah,
的
if you want to try this.
桡骨颈部。
That's the weak one. The middle one should be weak.
So here, and then place your middle finger, and then this way. So you can
The
rub
difference.
it. Interesting.